This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody who's here. So one of the things that we worry about after patients are intubated in the emergency department should be post-intubation hypotension. Patients sometimes, for whatever reason, become unstable afterwards. There's a lot of reasons why they can drop their pressure afterwards. And then there's been questions as to whether the induction agent matters and kind of has something to do with who becomes hypotensive afterwards. So most of the times, we're using either etomidate or ketamine because we think that they are hemodynamically stable and won't cause hypotension afterwards. There was a study recently from Australia that looked at, it was a chart review. It wasn't a randomized clinical trial, but it was a pretty well done trial that looked at what patients got for induction in this emergency department, whether they became hypotensive. Interestingly, about half the patients got ketamine, and the other half got Propofol, which is something that's used a lot in the OR, something that I'd say in the United States, most people typically stay away from in the emergency department intubations because there's a concern for it being likely to cause hypotension in unstable patients. But in this trial, what they found was that about half the patients who got Propofol did become hypotensive after intubation, and it was about the same. About 50% of patients who got ketamine also became hypotensive, and adverse events were about the same as well. So, there's a couple interesting things to take. One is that maybe Propofol isn't such a dangerous induction agent, maybe, but that also, even if you use something that's supposed to be hemodynamically stable like ketamine, there's a pretty good chance, about a 50% chance, that patients might get at least some hypotension afterwards. So it's a good reminder that we should keep an eye on patients' blood pressure just once they're intubated. It doesn't mean we can walk away and forget about them, that it's a pretty unstable period afterwards. Should be ready with IV fluids, push-dose pressors, and keeping a close eye on them after intubation. Questions or comments? Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.